This medication is used to help preserve kidney function and manage kidney damage and other problems in people with an inherited disorder called nephropathic cystinosis. This disorder causes the buildup of a certain natural substance, cystine, in the body. This buildup can cause kidney problems, slow growth, weak bones, and eye problems. Cysteamine helps the body get rid of cystine, which can help alleviate these issues. It is important to take this medication as directed by your doctor. Typically, it is taken in the form of oral delayed-release granules in a packet. The recommended daily dosage and the optimal timing for taking this medication will depend on your specific condition and should be discussed with your healthcare provider. Before you start using cysteamine, make sure to read the patient information leaflet and instructions for use from your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually twice a day, every 12 hours. To use, open the packet and sprinkle the contents on 4 ounces, half a cup, of applesauce or berry jelly and eat the mixture within 30 minutes of preparing it. Or you can sprinkle the contents into 4 ounces, half a cup, of fruit juice, except for grapefruit juice, stir the mixture gently until mixed, and drink it within 30 minutes. Do not crush or chew the mixture or save it for later use. Take this medication on an empty stomach, at least 2 hours after or at least 30 minutes before eating food. If you cannot take it without eating, you can eat a small amount of food, 4 ounces or half a cup, within 1 hour before and 1 hour after taking this medication. Choose one way to take this medication, either without eating or with a small amount of food, and take it the same way with every dose. Avoid high-fat food close to the time you take your cysteamine dose. The dosage is based on your weight, medical condition, and response to treatment. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. Do not drink alcohol while you are being treated with this drug. Drinking alcohol may increase the amount of this medication in your body, which may cause serious side effects. Take this medication regularly to get the most benefit from it. Remember to take it at the same times each day. Some common side effects of cysteamine bitartrate 300 mg oral delayed-release granules in packet may include nausea, vomiting, stomach/abdominal pain, fever, loss of appetite, bad breath, tiredness, drowsiness, dizziness, or diarrhea. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Most people using this medication do not experience serious side effects. If you experience any serious side effects, such as mental/mood changes, unusually deep sleep, unusual tiredness, headache, hearing problems, eye/vision problems, skin problems, bone problems, seizures, severe/bloody diarrhea, or signs of bleeding or ulcers in the stomach/intestines, it's crucial to seek medical help immediately. Cysteamine can commonly cause a rash, which is usually not serious. However, if you develop any rash, it's important to seek medical help to ensure it's not a sign of a severe reaction. While very serious allergic reactions to this drug are rare, it's important to seek immediate medical help if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist. Before taking cysteamine, make sure to inform your doctor or pharmacist if you have any allergies to cysteamine, penicillamine, or any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to talk to your pharmacist for more details. Before using this medication, be sure to inform your doctor or pharmacist about your medical history, especially if you or your child have liver disease, stomach/intestine problems, or a low white blood cell count. This medication may cause dizziness or drowsiness. Avoid alcohol or marijuana, as they can increase these effects. It's important to avoid driving, using machinery, or anything that requires alertness until you can do so safely. If you are using marijuana, make sure to discuss it with your doctor. Before undergoing any surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. Be sure to discuss the risks and benefits with your doctor. It is also unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. When taking cysteamine bitartrate 300 mg oral delayed release granules in packet, it's important to be aware of potential drug interactions. Certain medications or products containing bicarbonate or carbonate may affect the effectiveness of this medication if taken at the same time. If you are using a product with bicarbonate or carbonate, it is recommended to separate the time you take a dose by at least 1 hour before or after taking the cysteamine delayed release granules. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential interactions. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. It's important not to share this medication with others. Your doctor may also recommend lab or medical tests to monitor your cystine or cysteamine levels, as well as your kidney and liver function. Be sure to keep all of your medical and lab appointments. If you have any questions, consult your doctor for more details. If you forget to take a dose of cysteamine bitartrate 300 mg oral delayed release granules in packet, take it as soon as you remember. However, if it is less than 4 hours before your next dose, then just skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. Remember to store cysteamine bitartrate 300 mg oral delayed release granules in packet at room temperature, away from light and moisture. It's best to keep it out of the bathroom and to not open the packet until you're ready to use it. And always remember to keep all medications away from children and pets. When you no longer need the medication or it's expired, make sure to properly discard it. Don't flush it down the toilet or pour it into a drain unless instructed to do so. You can consult your pharmacist or local waste disposal company for the best way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.